Okay, once again, thank you all for joining. We want to ensure that all of the participants are accessing the audio in the language of their choice. So to select the language that you would prefer to listen in on, you'll navigate to the bottom of your screen where there's a globe icon, and you'll see options for English and French. Select the one you want and also select mute original audio if you would prefer to hear only the interpreted language. And if you have any questions, you can always send me a chat and I will do my best to help you. Also, we just have a couple housekeeping items. Please make sure your microphone is muted and you switch off your video during the presentations. Please introduce yourself in the chat box by providing your name, your title, and organization. There'll be a Q&A that's moderated at the end of the presentations, and you can send your questions in through the chat box and they'll be noted. And we encourage participants to engage during the event on Twitter using the hashtag #DemocratizeGlobalHealth and tweeting at the organization and panelist handles that are provided at the bottom of the screen. So I'll just hand over to our moderator, Crystal Lander. Thank you.
Thanks, Elizabeth, and welcome everyone. Thank you for joining us for this discussion on reimagined technical assistance for maternal, newborn, and child health services. As said, I'm Crystal Lander. I'm the Executive Director of Global Affairs at Pathfinder International. Pathfinder is an international sexual and reproductive health and rights organization with more than 60 years of experience working hand in hand with the U.S. government and local partners in over 100 countries around the world. We focus on health system strengthening and delivering voluntary family planning and reproductive health care. It's because of Pathfinder's commitment to assisting ministries of health to develop tailored approaches that meet the specific needs of their populations, especially adolescents and youth, and in different religious communities, that I was so happy to moderate this panel today. Reimagining technical assistance for maternal, newborn, child health, and strengthening national health systems. This discussion comes at a time when the global health and development community is re-examining itself on issues of race, class, gender, and privilege. A big thank you to Lois Pace and the team at Global Health Council for bringing this group together for this event as a follow-on to your innovative summit last year, which had the theme of democratizing global health. So now let's meet those who will be leading our discussion today. I will share their brief bios with you because my time is short, but as you can imagine, their accomplishments are not. First, we have Dr. Dionys Kasungami. Dr. Dionys is the Senior Child Health Advisor and Coordinator of the Global Child Health Task Force Secretariat based at John Snow, Inc., within the International Division based in Washington, D.C. Dr. Dionys is a public health physician with 19 years of experience in program design, management for reproductive, maternal, newborn, and child health, and collaborating with a broad network of stakeholders. Over the past 10 years, she has focused on strengthening health systems to enable scaling up of the integrated community case management and reviving the integrated management of childhood illness strategies in Ghana, Kenya, Nigeria, Zambia, and Zimbabwe. Next, we have Dr. Nosa Arabato. Dr. Nosa is a public health physician with a background in rural medicine and business management. He has over 30 years of experience and serves as the Deputy Director on Maternal, Newborn, and Child Health at the Bill and Melinda Gates Foundation. At the foundation and on the MNCH team, Dr. Nosa leads work on innovation and implementation research, data analytics, as well as the optimized scale-up and global adoption of MNCH innovations through national, regional, bilateral, global, and multilateral platforms and mechanisms. Most recently, he helped to advance the introduction and expansion of a national scale of MNCH life-saving commodities in Nigeria. Dr. Nosa worked with the World Health Organization from 2007 to 2011 as the Deputy Executive Secretary of the Health Matrix Network. Then we have Dr. Jean-Fidel Ayonga. Dr. Ayonga is the Director of the National Program to Combat Acute Respiratory Infections at the Ministry of Health in the Democratic Republic of Congo. He has held this role since 2003. He coordinates several donor-funded initiatives at the MOH headquarters, including the Integrated Management of Newborn and Childhood Illnesses Strategy and the process of reimagining technical support to the Ministry of Health. Dr. Yunga is a pediatrician and a lecturer in pediatrics at the Higher Institute of Medical Techniques in Kinshasa since 2004. And our final speaker, Dr. Joe Abai. Dr. Abai is the country director of DAI. DAI is an international development company that works with a wide range of clients, including national and local governments, donors, private corporations, and philanthropies in over 100 countries. Dr. Abai's academic interest is in how organizations in dysfunctional environments can overcome daunting institutional constraints and still function for the benefit of its citizens. Before joining DAI in September 2007, Dr. Abai was the Director General of the Bureau of Public Service Reforms in Nigeria, where he championed several reforms. So you can see, we're in great hands today. Please remember to share your questions in the chat box and comments on social media. I now turn the microphone over to Dr. Dines, who will kick us off with an overview presentation.
Dines, you're muted.
Thank you, Crystal, and thank you everyone for joining this presentation. Can we have the presentation, please?
Sorry, I thought you had wanted to share your screen. The version that you sent, it's not formatted right on my computer, so I think it would be best for you to share it.
Okay, let me have. Can you see the slides now?
Yes, it looks great.
Sorry about that. So reimagining technical assistance for maternal, newborn, and child health. I'll share very briefly an overview of this project. It was a great partnership, and you can see on the slide the different participants. If you think of this as a story, think of it as me sharing from the point of view of a facilitator of the process, which is what John Snow Incorporated and Sonder Collective, who are a human-centered design firm, did. You will later hear from the Ministries of Health perspective. We bring the voice of the DRC. Another government participation was from the Ministry of Health in Nigeria. We have the Bill and Melinda Gates as the funder, and we do have DAI representing the voice of an implementing partner. So what was our starting point? Our starting point was that technical assistance as it is currently delivered is criticized for being externally imposed, poorly coordinated, and particularly disempowering to the government and the countries that we seek to support. It is short-sighted, and it is not addressing the whole system and solving for public health challenges. Compounding that is the high investment in technical assistance that is not yielding the returns that we all look for. We observe that the rate of reduction in maternal and neonatal mortality is slowing in some places and even stagnating in others. This does not match the huge investment in terms of dollar amounts that is spent on technical assistance. And that is why we sought to address the problem, because the world has made a commitment to the Sustainable Development Goals. And at the rate that we are moving, we are not going to achieve the targets. We started this work before COVID-19, and now we are in a pandemic, so we have to face that reality. We still observe that countries need to accelerate their annual rates of reduction in mortality, that scarce resources are going to fight COVID. Health systems are getting weak, and essential services being curtailed. So we still have to ask the question, how can better technical assistance enable rates of reduction, accelerate rates of reduction in maternal, newborn, and under 5 mortality? When you think of technical assistance, we observe that technical assistance is a complex system and it exists within systems. The recipient governments and the health system have the private foundation, global health practitioners, foreign governments, technical assistance. These are organizations and individuals who bring their agenda, their motivations, and interests to the issue of technical assistance. What we seek to influence are the behaviors so that ultimately technical assistance achieve the benefits of better outcomes. Think of technical assistance as a transaction, giving and receiving among these various actors. So using human-centered and participatory design processes, we ignited new types of conversations and co-created a new vision for technical assistance, working with the various actors in the technical assistance space in the DRC and in Nigeria. So how did the process unfold? Very quickly. I said these are interactions amongst the actors. So we mapped those interactions to understand how the journey of technical assistance unfolds from beginning to end. We explored power dynamics because as these actors come to the table, they are not coming with the same power. And power has influence on how decisions are made and how actions are executed or programs are implemented. With those, key steps included identifying opportunity areas for change based on mapping the actors and the journey of technical assistance from beginning to end. 3 areas were identified. We needed to rethink interactions among the actors to create ownership. We needed to rethink the flow of information for decision making. We needed to rethink how incentives are used to strengthen capacity to deliver health interventions. Interestingly, the areas were similar in both countries with nuances. So for example, around flow of information for decision making, this is not just about data. It is also about funding information, how money flows and how money is used. And that was a very strong point from the DRC. And from Nigeria, there was emphasis around trust or the lack of trust amongst the actors in the TA space that influenced how people behave and how people perceive the results that we achieve. So using these opportunity areas, going back to the key steps, co-created and prototyped ideas to bring about the change, co-created ideas to solve for the technical assistance journey pain points, things that do not work very well from the perspective of the various actors. Defined the critical shifts and defined the principles of good technical assistance, and then developed the roadmap for change. And this was done by representatives of the various actors. Think about the map of who is involved, the governments, the donors, the providers of health services and recipients of TAs. And these worked as teams what we call co-creation teams. So what do countries want and need from technical assistance? This was defined in a first set called Technical Assistance Critical Shifts. There are 9 critical shifts that outline the changes that will need to be made to transform the current technical assistance system into a more ideal future state. These shifts create a bridge between the challenges that exist today to a vision for how things could work better to give us the outcomes that we need. I'll just highlight a couple of the critical shifts. Starting with the role of donors, moving from donor-driven to a country-driven and owned agenda. We want to shift away from a system where priorities are imposed on countries by donors to one where governments take an active leadership role in setting the agenda and the coordination of the technical assistance activities. We want to shift from creating dependencies to cultivating sovereignty of the governments and countries. We want to shift away from a system that depends on continuous donor support for survival to one which prioritizes sustainability and self-reliance. A third shift is around the lack of trust in institutions and individual motivation to scaling trust. We want to shift from a system which perpetuates mistrust in institutions and individual motivations to a more transparent, accountable environment which ensures credibility of its individual actors. And I hope you take the opportunity later to look through all of them because they are very instructive in terms of communicating what these actors in the DRC and in Nigeria want to see in future technical assistance. Then we move on to talking about the principles of good technical assistance, which if operationalized will get us to more effective technical assistance, achieving the health outcomes that we want. These were grouped into 4 domains, and I must mention that this is just the beginning of the synthesis of bringing these voices together. 4 domains of change. First is to focus on the system as a whole, and this entails that we focus on the health system rather than the individual technical areas. The second is to foster strong governance. And the key point here is it has to be a country-led approach, and specifically the rules of engagement should be common to all, and that the limits, the roles and responsibilities of all TA actors are supporting rather than executing state responsibilities. The third is to nurture the existing system. When we meet challenges, we tend to sidestep those challenges and create parallel system. In nurturing the existing system, we want to build on what exists and optimize the finances in the long term to promote government accountability, even if it means sacrificing the short-term gains of our technical assistance support. Fourthly is cultivating trust. I mentioned that particularly in Nigeria, this came out strongly, but we want that TA should invest in systems that keeps their users accountable. And it is reciprocal accountability for donors, for government actors, for implementing partners. Then these domains were then translated into principles of technical assistance. And these principles are meant to be action-oriented. The 4 domains each have certain principles, and then these principles were later defined into action points. So there are more details in how you translate this. But just a few examples. Focusing on the whole system, for example, entails that we start with a realistic, timely plan, because it sounds simple, but it is important if we are going to focus on the whole system. 1.4, as an example, we need to ensure continuous funding to the core priorities. Fostering strong governance, as an example, the need to balance external expertise with local knowledge. Nurturing the existing system means we need to adjust budgets to reflect realities on the ground, as an example. And lastly, cultivating a trust that we need to create space to iterate, learn from best practices, and also learning from failures is part of cultivating trust. When we can own our failures, then we all feel safe in this space. And as I said, there are details of how these can be acted on so that they are not just platitudes, to use that word. In conclusion, we leveraged the various voices of the actors in the technical assistance space in the DRC and Nigeria to bring these learnings. And bottom line, it is that reimagining technical assistance will ensure efficient use of TA dollars. It will empower governments, it will build the capacity of institutions, and it will have sustainable impact in lives saved. And this is even more important during this time of COVID, and I invite you to use these resources that you can find on the Child Health Task Force website. You can email, and we can continue this conversation to change our behaviors in how we interact to make technical assistance more effective and to improve health outcomes for mothers and children. Thank you.
Thank you, Dr. Dynas. That you really started the conversation, you framed it. And so now we're going to go into more of our discussion with our panel of speakers. And Dr. Nosa, I'm going to start with you. Why is reimagining technical assistance urgent and necessary for donors? We've heard a little bit in the opening presentation, but a little bit is, what is the appetite from donors? Are they comfortable with this? Do they want to be a part of this?
Well, first of all, thank you very, very much. And let me just also begin by thanking the governments of the Democratic Republic of Congo and Nigeria for agreeing to participate in this work that JSI and Sonder Design, have led. To address the first part of your question, as we were thinking here, let me also preface by saying that I have been a medical officer in a district in northern Nigeria. I've been a chief of party with JSI. I've worked for the World Health Organizations, and I've led the massive grant portfolio at the Global Fund. And here I am now at the Gates Foundation. So just to say that this discussion around technical assistance is something that I'm intimately familiar with from different perspectives. But from the point of view of our work here at the foundation, as we thought about the lack of progress or the lack of progress in bringing down maternal mortality and neonatal mortality, one of the things that we were struck by was, again, from the foundation's perspective, in what ways can we utilize what we characterize as the global architecture, the global health architecture, to drive progress, to help countries writ large, to achieve the SDGs? As we had this conversation, the thing that sort of became clearer to us was that we needed a better way of characterizing the global health architecture. And the way we chose to do that was to look at the functions of the global health architecture. So this slide that you have in front of you lays out 4 boxes with a circle at the center. And what may surprise, what may or may not surprise you is that in a lot of discussions around the global health architecture, countries are completely missing from that picture. So one of the things that this conversation that we've been having is that if we do not place countries at the very center, it's going to be very, very difficult for us to achieve the kinds of progress that we aspire for. So the 4 functions that we sort of envisioned was, one, there's the notion of agenda setting. That's what's the direction, how much do we want to achieve, and by when. And it turns out that that particular function, the agenda setting function, is largely addressed by the SDGs, the Sustainable Development Goals, and the global strategy. So we have a northern star in terms of where we want to go. The second area is financing, and how do we get more money into to finance, our MNCH globally. The World Bank has been in that space for quite some time. The Global Fund has been there. Gavi has been there, and more recently, the Global Financing Facility has also joined that with us. So, things are cooking, maybe not to the best, but there is good progress in the financing space. On data and monitoring, again, there has been substantial progress in this area as well. Tracking using Countdown 2030, the work of WHO, standardizing indicators, and the work many of you do in several countries has actually helped to drive this area forward. The one area that we became more aware of, that we felt we knew the list about and has not really been critically appraised, is this notion of technical assistance. And when you look at technical assistance, you find that it is the means by which expertise, dollars are available to drive progress. And if those dollars are not being used in ways that actually help countries to achieve not just short-term progress, but long-term progress, then we miss the opportunity. In some of the health financing work that we've done, quite a few countries in sub-Saharan Africa rely on donor funding for up to 40% to drive health, to drive health work. So imagine now if that money is not being utilized in ways to help countries to achieve the results. You and I can put the dots together. So I think that the work that JSI and team have done and Sonder Design is really to help us to begin to interrogate this space and to figure out how can we do it differently. And now that we have COVID with us, it is really imperative for us to figure out how to make this work better and to serve the needs of countries and to serve the SDGs. So the second question, do donors have an appetite for change? The way this work has been designed, JSI and Sonder worked extensively with donor actors on the ground to get their viewpoint. And I think if you have a chance to see the transcript, you find that there's been really honest conversation from the parts of the donors on the ground. In the foundation, this particular subject is gaining really important traction. Within the health sector, it's really driving a lot of our thinking on primary health care. It's driving a lot of our thinking on our work in the Africa Region Office. And our colleagues in the global education are beginning to see that, the same issues of TA is also affecting how we do work, in the education sector. The other very interesting development arising from this is that the USAID, Washington, the foundation and the World Bank have come together to form an interagency working group for us to really think about how we begin to systematize and use these principles to shape the ways in which our TA dollars are spent to achieve the most impact. So these are some of the shifts. I think we're at the beginning phase right now, and we hope that with good time and that these ideas will spread. But as Dinah's, referred to, it has to be based on concrete, doable, executable actions. Thank you.
That's fantastic. And I'm sure people will have follow-up questions, but thanks for that, giving us that perspective from the foundation, but over your life and all your experience. Dr. Abai, I want to go to you next. Implementing partners sit between the donors and the government. So how, from your perspective, do the TA principles help the implementing partner to negotiate between the two? You know, you have one person on this side, one person on this side, they don't always meet. So what is that role?
Dr. Abai, it looks like you're on mute. Sorry to interrupt.
Sorry, thanks very much, Crystal. I didn't realize I was on mute. I'm never muted. I think Dinah's represented our role very well. The work that DI does for the Gates Foundation in Nigeria, when she said that we represent the voice of an implementing partner, because DI is involved in an innovative approach to delivering technical, which is essentially
It looks like Dr. Abai may have froze. I'm not sure if maybe he'll reconnect. Crystal, perhaps we could call on our colleague Celestin Nisibu, who could speak to the presentation for Dr. Ilunga.
Okay, so Dr. Ba, if you hear us, we're going to move on to the next presenter, and then we'll come back to you. Celestine is going to be presenting on behalf of Dr. Ilunga, who is having some technical difficulties. Celestine?
so sorry. Can you still hear me?
Yes, we can.
Right, we can hear you now. Yes.
Okay, I'm so sorry. I lost internet connectivity for a little while.
We work in this area. We understand.
So I was saying that, that what has been the history so far is that implementing partners go to beneficiary governments and sort of engineer demand and say to them, you know, did you know you really needed this? And the government goes, oh, did we or do we? And then the implementing partner convinces the donor to fund such a project. There's very little ownership from the government. The implementing partner does the implementation, uses all of their own staff to do the delivery, brings all of their own laptops and goes away with all of their own laptops and leaves nothing behind in the States. That has quite often happened in this environment. The state government, on the other hand, says to the donor, oh, you say you spent $10 million in my state or in my province or region. Where is it? Nobody ever involved me in any of that delivery. The donor, on the other hand, is torn between, do we wait for the state government to make a request, or do we fund the implementing partner to try and get something going in that particular environment? And so what we try to do with the TA hub is essentially to keep everybody on the straight and narrow. So we try and support the state governments and the beneficiaries to be able to articulate what support they actually want from the donor. We then curate it and have that independently assessed, and then through an independent review panel, determine which implementing partner is best suited to deliver that piece of work. And on the side of the donors, because we are independent, we're able to say to the donors, well, don't listen to everything your M&E advisor says. Certain things will not be deliverable within certain timeframes. And if you're going to do it, this is a long haul, and you're going to need to commit to it for a long time, and you're going to need to be able to trust the fact that it may be slower when the beneficiary does it than when the place is flooded with consultants who just do the task and go away. And so the implementing partner, as I said, if functioning properly, actually plays quite an important role in serving as that interface between the beneficiary and the donor. With regards to the beneficiary, which in this case is the government, that role can span across a number of themes. So they can contribute to policy setting because they know what works or what tends to work and what tends not to work. And so they can engage with the state government in policy development. They can also engage with the state government or with the beneficiary government in terms of planning. So how do we plan properly, and how do we link policy with financial resources, with human resources, and as part of that, develop their capacity to plan realistically. They can also work with them in actual delivery of the technical assistance to make sure that they are part of the delivery and that there is a transfer of learning in the way that delivery is done. And also that the government is in the driving seat of that delivery. I think Dianes had in her presentation outlined a number of governance principles, which include ensuring that government is in the driving seat, ensure there's a balance between external expertise and local knowledge, building local capacity, engaging communities to ensure that their voices are heard in the design of interventions, avoiding a one-size-fits-all approach, and following local protocols about what works and what doesn't. The implementation partner can also help with coordination, again, to make sure that capacity development is sustained and that local knowledge is infused into the system. Working with the donors, the implementation partner similarly has a unique opportunity to be able to say, look, this is what government is really thinking. They may not be telling you that, because when a donor visits a beneficiary government, the discussion is often at a high, if you like, diplomatic level. Nobody wants to offend the other, and the discussions are usually quite polite and friendly, but masks a lot of issues on the ground. A bit like synchronized swimming, all graceful at the top and complete chaos underneath. And so the implementation partner can actually say to the donor, look, this is what government really thinks, and this is what we're finding out on the field. It can also guide the donor in terms of how it deploys technical assistance and in what areas those technical assistance will be better deployed. It can help with allocating funding, and it can help with just integrating the way that the beneficiary thinks into the way that the donor itself thinks, and improve the linkages across all these efforts. Just finally, the one advantage that an independent body like the technical assistance hub, which DAI is incubating in Nigeria. The one additional advantage it brings is that it brings in learning from different parts of the world. You know, good practice in terms of the technical areas, innovations like responsive feedback, ensuring that you iterate, learn from problems and use it to adjust what you're doing. It brings in implementation research as well. Again, just being able to integrate what you're learning in the field to ensure that implementation happens better. And it also is able to bring in and embed technical assistance within the training facilities of the state government itself. So the Civil Service Training College, the Leadership Academy, whatever it is that the beneficiary government has in place is where the technical assistance hub will ensure that that capacity and institutional memory rests. And so this is why we're very excited about what we're doing. It's not easy because we have to change a lot of cultures. So we have to change the culture of the government, trying to play donors against each other and donors against implementing partners. We have to change the culture of implementing partners who are used to relating to donors and to state governments in a particular way. And we also have to change the culture of donors themselves and improve the way they relate to both parties. That's why we're so excited about what we're doing. Thanks, Crystal.
Dr. Bai, I hear it in your voice, the enthusiasm about the change you want to see and where we're getting started. So I'll be very interested in some of the follow-up questions that I already see coming in. So it looks like we have our colleague Celestine, who will be coming in and giving remarks on behalf of Dr. Yunga. Celestine, are you on the line?
Looking for, yeah. Yes. I'm not, yeah. Just I will read in French because I'm French speaker, and it will be good for me to read on French.
That is fine. Everybody can change. They can everyone can change over their translation who needs it into English. Thank you for jumping in for us.
Yeah. Because Dr. Ilunga has a problem. I don't know if he can join us. Utilisation du nouveau modèle de l'appui technique pour l'amélioration des prestations en RDC. Point de la présentation. Qu'est-ce qui s'est passé? Qu'est-ce qui a été réalisé? Et qu'est-ce qui sera fait? En quelque sorte, ce sont les trois questions que nous nous sommes posées pour relater tout ce qu'il y avait eu comme processus et procédure à travers ces projets. Slide. Yeah. Qu'est-ce qui s'est passé? Alors, qu'est-ce qui s'est passé en détail? Effectivement, la situation actuelle. La situation actuelle est caractérisée par une inadéquation entre les appuis et le résultat obtenu. Alors, qu'est-ce que la réimagination du nouveau modèle de l'assistance technique a apporté? Nous disons que c'est une réponse à un besoin ressenti par le pays. Alors, entre le mois d'août 2018 à mars 2020, tout le processus a été conduit sous le leadership du secrétaire général à la santé à travers une équipe locale technique qu'on avait appelée l'équipe de co-création. L'objectif général était de pouvoir créer une feuille de route pour l'application de nouvelles normes et standards d'assistance technique en vue d'améliorer la qualité et l'efficacité des prestations des services de la santé reproductive maternelle du nouveau-né, de l'enfant et de l'adulte, ainsi que la nutrition. Alors, qu'est-ce qui a été réalisé? D'abord, c'est une vision pour l'avenir de l'assistance technique en RDC. On a co-créé cette vision de l'assistance technique pour l'avenir. On a eu effectivement les 4 domaines de changement dont venait de parler tout à l'heure d'INES qui ont été identifiés. Il y a eu 17 principes à respecter qui étaient définis et 9 recommandations ont été formulées. Parmi les recommandations, nous pouvons citer que le gouvernement va négocier avec les donneurs pour éviter l'approche, donc pour éviter une approche à l'emporte-pièce, c'est-à-dire déjà calqué sur un modèle qui nous a été imposé, alors que ce qu'on voulait bien que ce soit un modèle qui soit élaboré au niveau local. Alors la dernière question, qu'est-ce qui a été fait? Et qu'est-ce qui a été fait? C'est ce que nous allons voir dans la diapositive qui va suivre. Diapositive. Alors, pour la diapositive qui va suivre, il faudrait voir le truc en 3 niveaux. Il y a d'abord le processus de validation. Deuxième niveau, c'est les principales actions. Et enfin, au 3e niveau, ça va être le résultat. Alors, pour le processus de validation, le processus doit s'arrêter à la fin de ces mois-ci. Ça veut dire que le document est passé cette semaine à la commission de gouvernance. De la commission de gouvernance, ces documents vont être présentés, soumis le 31 juillet au comité de coordination, qui est un comité technique. Dès que ces documents vont être validés au comité technique, ça sera maintenant l'affaire des politiques, donc essentiellement du ministère de la Santé et de ses partenaires, pour une grande, ce qu'on appelle le comité national de pilotage du secteur de la santé, qui regroupe le ministre de la Santé, ainsi que tous les partenaires, à savoir le bailleur, les assistants techniques, ainsi que la communauté et tous les autres bénéficiaires. Alors, pour les principales actions, il faut savoir que pour arriver à ces résultats, il y a eu plusieurs choses qui ont été faites. La première action, on avait mis en place un comité de suivi pour voir tout ce qui concernait le comité, donc l'assistance technique. Et ce comité de suivi est piloté par la direction de planification. Après cela, il y aura une vulgarisation de tout ce qui a été élaboré dans les 26 provinces qui constituent le pays. Et ça sera une grande vulgarisation qui va se faire pour que les gens qui sont sur terrain arrivent effectivement à bien apprécier ce qui a été fait sur le plan central. Alors, la 3e activité qui est faite comme action, ça va être la prise en compte des principes du nouveau modèle de l'assistance technique dans les différents plans. Il faudrait que ce qui a été dit, que chaque programme, que chaque secteur puisse l'intégrer dans ses plans et aussi les intégrer dans les différents documents stratégiques à tous les niveaux, à savoir au niveau national, au niveau provincial et au niveau opérationnel, donc disons au niveau comme chez nous, c'est le niveau district de santé ou zone de santé. Alors, après cela, il faudra maintenant faire une mise à jour de la cartographie de toutes les interventions, de dire qui est qui fait quoi et il est où. Et c'est en fonction de cette cartographie que le ministère pourra avoir une vue d'ensemble de tout ce qui s'est fait sur terrain et comment cela est fait. Après maintenant, il faudrait passer à la 4e action qui va être l'harmonisation consensuelle du manuel de procédure. Il faudrait qu'il y ait un seul manuel de procédure qui soit produit et pas le manuel de procédure de chaque intervenant. Et comme 5e action maintenant, il faudrait suivre ce qui se passe sur terrain et ce qui se décide. C'est ainsi qu'on va organiser une revue régulière des termes de référence pour les appuis techniques, les assistants et les encadreurs provinciaux polyvalents. Et enfin, il y aura un transfert progressif de compétences qui ont été tout à fait là, vers l'expertise locale. Voilà en gros sur les principales actions. Alors, ces actions ont produit quelques résultats. Ce sont ces résultats que je pense que Dan a essayé de brosser ces différents résultats. Mais c'est que nous savons que, nous avons pu avoir un nouveau modèle d'assistant technique qui devait être imposé à tous. Nouveau modèle d'assistant technique imposé à tous. Le deuxième résultat palpable, c'est que ce nouveau modèle d'assistant technique va être intégré dans le système de santé parce qu'il va contribuer à renforcer le système de santé. Troisième élément, ça va être la capacitation des expertises locales. Vous savez que au niveau pays, nous avons une vision de pouvoir renforcer les capacités des provinces. Et comme on va faire une dissémination à travers les provinces, une capacitation ou un renforcement des capacités va se faire au niveau provincial. Quatrième élément que nous avons pu avoir, c'est la maximisation de la transparence et de la redevabilité à tous les niveaux. Cinquième, c'est l'optimisation et la rationalisation de ressources humaines et financières. Parce que vous savez que nous sommes des pays qui n'ont pas beaucoup, donc qui ont des ressources limitées. Et une bonne organisation va faire que le peu de ressources que nous avons, autant matérielles, humaines que financières, vont être rationalisées. Et enfin, il y aura comme action, c'est que les prestataires vont se trouver valorisés et par conséquent, ils vont être motivés. Alors, tous ces éléments vont contribuer effectivement à l'amélioration des prestations. Voilà en gros ce qu'il y a sur cette dia que nous venons de vous présenter. Merci.
Thank you so much. This was excellent. And again, thanks for jumping in there. I think we all realize that sometimes technology doesn't work the way we want. So I'm going to ask our presenters to get ready for questions. We had quite a number of great ones come through, and just going to pick out a few to get us started. Dinah, a couple questions for you. I'll give you a few for each speaker, and that way you can address them. The first question is, how much did the TA translate into reduction in maternal, newborn, and child mortality? And how were you able to demonstrate the TA return on investment? And then another question for you is around country ownership. It's important, however, how far can donors be engaged to enable the recipient countries to plan their own agenda while also being conscious of the interests of the funders? So that one actually was addressed to you and Nosa.
Thank you. Thank you for those excellent questions. How TA translated into changes, I want to just highlight that the work in both countries ended in March of 2020, so we haven't moved to where we can begin to show results. And in the spirit of the principles where we have to be patient and look for long-term change rather than short-term, we remind ourselves. But what we hope is what is going on in the DRC, where the government takes the reins. They are in the driver's seat, and they are going to use some of these principles and begin to insert them in the processes and in how they interact with the donors and with the local implementing partners, and how they interact within the system, because they are also providing technical assistance, for example, from the national level to the lower level. And it is all those actions coming together to eventually bring about the change that the actors have agreed to, and ultimately resulting in better outcomes and achieving the sustainable development goals for mothers and children. Over.
Okay. And then Nosa, I'm going to have you address the second part, which is country ownership is important, but how far can donors be engaged to enable recipient countries to plan the agenda while being conscious of the interests of the funders? And then adding on to that is, how much of that influence impacts short-term funding cycles, 1 year, 3 years, in kind of your aid effectiveness experience?
Yes, thank you very much. I think the question about country ownership and engaging with donors was from Lawrence, and so Lawrence, the in terms of how donors ought to engage with countries, I think one of the key ideas that has emerged from this work that I also, from my own experience, I recognize also works is really to start with a position of respect, for countries and for where countries are, and also to recognize that countries have plans. They may be imperfect plans, and also that we've worked to align our contributions, align our efforts within the country plans themselves. The other area, which I think was also reflected in some of the findings from the work by GSI and Sonder Design, is the idea of ownership of data. Whoever owns the data owns the program. Ways in which countries can actually be enabled to systematically collect their own data, systematically use their own data, in the long run pays off greater dividends. So those are some reflections to that question. If you could just remind me of the second question, Crystal.
Yeah, it was around the influencing the short funding cycles, the 1 year to 3 year programs.
Yeah, it's these are questions that we have to wrestle with, and I think that I think in the long run, countries will profit from a longer time horizon in terms of financing, but that's not necessarily guaranteed, something that can be guaranteed. So there is some wrestling that needs to be done. Having said that, if investments are flowing in such a way that they are consistent with the country plans and consistent with country priorities, then the funding cycle ought not to be as they ought not to be as much of a barrier as there might be right now. So as Joe mentioned, there are behavior change issues that need to be addressed between all the parties. But also, just to say that this whole notion about technical assistance is really about disrupting, the balance of power. Power is unevenly distributed between the various actors and players, and we need to figure out how to reconstruct the power such that it is in the hands of those who have the most to do to help to produce the outcomes, and that each one is playing their various roles. We cannot walk away from power as a critical construct in this conversation. Thank you.
Yeah.
Can I just add?
Sure.
Can I just add to that question? In the conversations, in both in the DRC and Nigeria, all the actors, including the donors, agreed that we need to change how we do business. So they were aware, and they were also aware of their own contributions. This is where the approach of human-centered design and participatory engagement and bringing the various actors together worked well. There was awareness, there was acknowledgement of the challenges. There was also acknowledgement of the sidestepping that happens when things don't go the way we want them because we want short-term results. So from the donor perspective, they said we are part of developing those plans, but somewhere on the way we put those plans, that strategic plans that we have developed together, we put them aside and opt for a short-term quick results. So that is a challenge where we have to change behavior as different actors. Then another challenge that came up is around they want the government to be in the leading in a leadership role and to lead the process. But again, there are changes in government that come up. So where they had trust and hoping that things are going to work, a year or months down the line, there's change in government. Those are realities that they also recognize that they also happen in donor organizations, that leadership changes. And because of that, there is not consistency. So that idea of changing how we behave and being focused on what ultimately we want to achieve will bring us back to the table and will also help us interrogate the challenges, because the challenges are real and they have to be addressed.
Well, Diana, she just led us right into one of the other questions that was asked around what has been some of those challenges. And one specific question, and Dr. Bio, I want to turn it over, have you start with this one, is you have these challenges, you have these pushbacks from donors when you want to create more ownership on the ground. And one example was, or even a pushback from the government to say, we want at least 50% influence on the recruitment of implementing partner staff working on a project or working in a state or a region. Have you, have come across these problems or challenges, and what have you done, or what are the recommendations on how to do this with this new framework?
Okay, I think there are two aspects to the question. The first aspect is in the way that an independent technical assistance hub works. And so a beneficiary government is supported to be able to articulate what they want. An independent review panel of experts reviews it and decides who the best implementer would be. And then, the hub itself supports both the implementer and the government in trying to get the intervention done the best way possible. There are two extremes. One extreme is the government wanting to take over everything. The other extreme is the one I described earlier, where the implementing partner just arrives with a truckload of consultants, who do everything and then disappear into the night. And so long as there's a sensible discussion, there is a need to rely on some capacity in the state. It's no point when you have an army of civil servants who are underemployed to again bring in an army of consultants to do certain basic work, some of which may be administrative, some of which may be logistical. Of course, if it's high caliber technical assistance and expertise, which is not present in the state, then I don't think the state will argue when you want to bring that in from outside. But it's just just making sure that you are able to leverage on whatever capacity exists. And what we've found from experience of reforming governance institutions in Nigeria over the last 20 years or so, is that actually the capacity within the government is higher than both the donor and the implementing partner realizes. But by the time you flood the place in with consultants, the government will tell you, well, we don't know anything. We need capacity building, come and train us. But the minute the donor is not there, and for the areas that the donor is not involved in, they are actually implementing things. They're actually building their roads. They're building their agriculture. They're doing a lot of other things. So I think there's a need for a sensible balance to be struck, and that's why having an independent body that encourages this open dialogue has a tendency to work quite well. But no, we can't completely dismiss the wish of the government to be involved. But at the same time, we cannot let the government just appoint cronies and friends of the governor in order to benefit. That will not be allowed to happen.
Great. This is a question for everyone. The Paris Declaration on Aid Effectiveness and the later work of the IHP Plus, this was, focusing on some of the same problems or issues brought up in the presentation. What was your experience with this, and has that changed the discussion in the countries and where you work? Again, anyone can jump in on that one.
I think we should nominate Nosa to go first.
Yeah. So it's Now, I think that question is very, it's really appreciated. It really underscores one that, you know, this is a perennial problem that we've been facing for quite some time right now. And there have been various approaches, the Paris Declaration, the IHP Plus, and now we're having this conversation around technical assistance. The reality of it is that, you know, it's possible that there has been progress over the years. However, the appetite and the need for far greater progress cannot be denied, you know, right now. And one of the things that this work is attempting to do is to really hone in on technical assistance as a function and to figure out how we systematically use, you know, with the focus on the function and with the focus on countries and the focus on country ownership, how do we begin to unravel the behaviors that have perpetuated, you know, a pattern where resources come in, but they do not necessarily translate to the highest dividend for countries and for outcomes. So this is a journey that we're taking right now, and we're at the early part of this late journey. And I look forward to us working together to figure out how to make this work for country. At the end of the day, if a woman is having a baby in a village somewhere, whether it's in Nigeria or Uganda, and there are resources available that could have prevented a fatal outcome, then I think it's a collective letdown that I think the time now is for us to figure out a way to move forward and to get results in a very concrete and predictable and ongoing way. Thanks.
Great. Dinus, you want to take this one?
Yes, just to add a couple of thoughts. First, that indeed the Paris Declaration have been there, and this work did confirm what the Paris Declaration and the principles actually recommended. This work adds to the voices, and in particular reflects the voices at the lowest level, the country level, were not involved in the formulation of the principles. So it confirms. The other element that strongly comes out is the need for the various actors to act together and reflect on their unique context in how they apply the principles. And that's why the principles have the component of what does this mean in action. And what we have now is based on the two contexts that we were working. But the hope is that, as Nosa has said, this process would be replicated and each country brings the key actors to the table. They interrogate the power dynamics that drive how technical assistance is planned and how it is implemented and the results that they achieve. And then together they chart that way forward, and there is that mutual accountability amongst the actors, not to a funder who is away somewhere, but locally, and also includes the communities as an important voice. That came out very strongly in this discussion. Over.
Great. And Dr. Vai?
Okay, so first of all, it's ABBA, just
ABBA,
like the musical, band. So I think Dinus and Nosa as well have very, very clearly articulated the issues. You know, the reimagining TA principles do align completely with the Paris Declaration and other approaches, other good practice approaches to delivering aid. I just want to add a little bit of a clarification, which is what exactly do we mean by technical assistance? And in this particular case, we've defined technical assistance to be different from humanitarian aid. And so in technical assistance, we're not giving commodities, we're not giving vaccines, we're not doing any of that. What we're doing is catalyzing ability of the government to solve its own problems by giving it the high quality expertise it needs to think through the solutions that it needs to provide to its people. And that's why it was very, very important that at the start of this, we engaged with the relevant governments that we had to work with and said to them, look, we're not going to fund study tours. We're not buying laptops. We're not buying SUVs. We're not doing any of that. What we're going to do is provide you with the support and the expertise to actually solve the problems you have. And without exception, every single one of them said, this is exactly what we've been asking for all these years. And so I think conveying the reimagining TA principles, which the TA Hub has the responsibility to actually put into practice in Nigeria, found a lot of resonance with the governments. Surprisingly, or believe it or not, it's going to take probably a bit more behavioral change among the donors themselves to actually think, look, yes, there is a tension between intervening immediately to stop a humanitarian crisis, but also investing in the long-term re-engineering of the beneficiary of technical assistance. So that is happening, and I'm very, very impressed with the work that NOSA and others are doing, just trying to get various colleagues from different parts of the organization involved in this discussion. And I think once people have that discussion, they realize that you can't really argue against the principles. They are, self-evident in their usefulness.
Perfect. And Celestine, we would love to have you weigh in on this question.
Je ne sais pas si, bon, moi, Célestin de DRC. Alors, je veux juste intervenir parce que, bon, cette histoire de pouvoir de définir l'assistance technique est vraiment essentielle. Effectivement, un consensus peut être trouvé au niveau de bailleurs ou de gouvernement, mais il y a aussi un problème avec les bénéficiaires. Souvent, nous voyons que le niveau central, le niveau gouvernemental, au niveau de donneurs, mais ceux qui bénéficient de cette assistance technique, ils disent quoi? Et c'est ça qui fait que, par exemple, chez nous, en RDC, on a eu des problèmes pour faire passer le message de l'assistance technique. Parce que pour le bénéficiaire, ce n'était pas simplement l'expertise technique. Il y avait aussi tout ce qu'il y avait comme capacitation sur le plan des ressources, les ressources matérielles, les ressources financières. Vous voyez? Alors que la vision que incarne le projet, c'est véritablement l'expertise technique pour accompagner la capacité locale à faire quelque chose. Mais cet accompagnement de la capacité totale à réaliser les actions nécessite quand même des ressources. Alors, c'est comme ça que vous allez voir que chez nous, quand par exemple les groupes de co-création s'est réunis, ils ont dégagé deux principes. Et ils ont fait la part des choses entre assistant technique, qui est excessivement l'expertise technique, et l'appui technique, donc c'est en français, bon, je ne pense pas comment on peut le dire sur le plan en anglais, qui va intégrer non pas simplement l'expertise technique, mais l'apport des ressources, autant matérielles, financières. Voilà, je pense. Et c'est tout ça. Donc, je pense que chaque pays, chaque contrée a des particularités. Il faudrait vraiment, avec les apports donc, des anthropologues, fouiller pour que ça change dans ce sens. Voilà un peu ce que je pourrais apporter donc, comme élément dans la discussion.
No, that was great. And thanks for bringing that up because I think it's really important. I think we have time for one more question that I'll throw out to all the panelists. It came in from Ethiopia, and I think is one we haven't addressed yet, is how we coordinate the technical assistant or reimagine it to include improvements of health system sustainability by ensuring that bridge between projects and the gaps with matching funding or by design or collaborative funding or even performance-based funding. So I opened it up to everyone to thoughts on that. The bridging between projects and activities.
Let me go first this time. So again, part of the one of the things that that Diners talked about was this need to ensure that there was ownership, and part of that ownership includes actually putting your own money or bodies on the table. So sometimes the beneficiary doesn't have the money to put on the table, but they have the human resources to contribute to that project. At other times, or most times, you also don't want you know, a sort of substitution to happen where they spend all their money in trying to send a man to the moon, confident that the donor will pay for all their health care. And so part of that ownership and dialogue is, okay, if we're going to do this and for it to be sustainable, it needs to form part of your normal system. Your normal system includes your normal budgeting system, your normal capacity building and training system, your normal promotion and compensation system. All of those, that's the only way that these initiatives and investments are going to be sustained over time. And in order to do that, even if all you have is $10, let's plan that in and let that $10 be in your budget. And let's agree when you release that $10, because at a particular point in time, the donor needs to be able to say, we've done what we agreed in the MOU, the next step is yours. And until that next step is taken, it's difficult to move forward. If you don't do that, then the technical assistance just becomes vertically linear, where you continue to invest and invest and invest, and there's no movement on the other axis along institutional change and ownership. And so that's why it's really, really important for sustainability to ensure that there's a clear commitment. Like I said, even if it's not financial, it's also human resources, releasing the relevant people at the relevant time, releasing whatever it is that is budgeted for that intervention when it needs to be released. And this needs to be made clear to the government upfront, and the donor needs to be strong enough to actually say, no, unless you do this, we had an agreement, unless you do this, it's going to be difficult for us to move forward. That doesn't mean that the donor does not intervene when there's a humanitarian crisis. I mean, you cannot fold your hands and watch women and children die just because the government is not responsive. So you still do the humanitarian things. And that's why we've made this distinction between humanitarian interventions and technical assistance in terms of providing expertise.
Great points. Celestina, I want to call on you to make a comment on this question.
Oui, par rapport à cette question, moi je pense que tout dépend aussi de celui qui a pris les leads. En réalité, nous avons pu voir aussi, c'est un problème d'engagement. Parce que par exemple, chez nous, le secrétaire général qui est les techniciens du ministère, qui n'est pas politique, lui comprenant mieux le problème, c'est vraiment engagé. Et c'est lui-même qui prend les leads, qui est en train de tirer toute la machine. Alors que bon, les autres, que ce soit les politiques, les autres, c'est un peu de traîner, mais lui, il tire la machine. Donc, ça aussi, ça dépend des individus. Quel individu vous avez dans le processus? Est-ce l'individu est suffisamment coaché, bien suffisamment informé, impliqué? Donc, son implication personnelle améliore aussi l'évolution du processus. Parce que là, si quelqu'un est vraiment engagé, il croit, et il a aussi lui-même dans son évaluation cette question-là, vous allez voir qu'il est mieux engagé et il va vite. Il va vite pour mobiliser tous les gens, pour appeler les donateurs, pour appeler les autres partenaires techniques. Mais si la politique ou quelqu'un n'est pas suffisamment engagé, effectivement, comme l'avait dit tout à l'heure Abba, on risque tout simplement d'avoir fait comment je peux dire, un projet, mais qui va juste s'arrêter là.
So if I may contribute, and then Dinus, you're the leader here, so you can round up for us. So I think the question, if I think it was from Yared Abera from Amref, Salam. So if I look at your question, it seems to me the key question is the how. How can we coordinate TA or reimagine it to improve health systems on a going basis? I think one of the really, in my view, one of the really important contributions to this work is really those sets of principles that Dynas, JSI, and Sonder Design have actually really cultivated with the government of the Democratic Republic of Congo and Nigeria. They're very concrete. And I think what remains now is how do we translate those principles into actions? And I think that is the journey that we're being called on as a collective to take part in. And I think that it is possible. It's possible and it's doable. And I invite all of us to really join forces together for us to figure out how to make this happen at the benefit of that woman and that child in my country or in other parts of Africa or in Asia, that it could make a difference and it could be life-saving.
Great. Dennis, last comments.
Thank you. I also just wanted to go back again. It's the critical shifts and the principles, and specifically refer to defining technical assistance and the specific question in Ethiopia. I wanted to refer to the critical shift on moving from supply-driven to problem-focused, because supply-driven technical assistance this is what we have to offer you. And so the government says, yes, come, because that's what you offer, so we accept it. Versus problem focus, which is what problems are we trying to solve in order to enable the health system to deliver for mothers and for children. And then when we come to the domains, we talk about all the domains are important and they feed into each other. But specifically, if you refer to domain number 3, where we are saying nurture the existing system, that is how we get that answer for how Ethiopia and the partners get to that issue. And then ultimately, there are very specific principles and actions that we can follow. So just to reiterate what Nosa said and what I said in the beginning, that this has been a very useful process, and we have a step-by-step report on how it happened and some tools that can be used. So any country, any partner can actually use these resources. They might need additional support to use these tools, and then that becomes a question of, I want to use this. How do I follow this process in my context? Because it has to be context specific. But there are principles we follow, and there are actions that we do in practice in order to get us to the change that we all desire. At least there is consensus that the ultimate that we are after are better outcomes, achieving the sustainable development goals, and we are all agreed about that. So we can use these principles and other approaches that are emerging to move us forward. Thank you.
That was perfect, Ines. It was the perfect wrap up to this discussion. I know for me, listening to you kick off with the principles and domains of change, so many pieces came out of that. The cultivate trust, I think, is really important, because you always hear, well, you can't do it this way because there's corruption or different things, but you have to nurture the existing health system, like you said, and invest in it. And when it really comes down to it, like Nosa said, you really have to, we have to make this forward. We have to be moving in the right direction. And it's really about, which was my favorite point, was disrupting the balance of power, because we know that this is what this is all about. We have to shift the power and be comfortable, particularly in the area where we work. We want to see lives saved. That's why we're all in this work. But that means disrupting the power and recognizing the power dynamics that exist. And Dr. Abba, your point around, bringing in a flood of consultants without recognizing that there are capacities already many times that exist that we're not recognizing or nurturing or paying attention to, I think is so important. I think we've all seen it. And it's time to really recognize, reflect back and say, you know what, are we a part of the problem or are we part of the solution? And Celestine, big, shouts out to you, and thank you for joining us and pitching in at the last minute to make sure you shared the experiences from DRC. I think it was really important to have those specific examples of how it can work in sometimes really difficult environments, but the commitment to be there and to do the work is so important. Overall, my colleagues from Global Health Council, thank you for pulling this all together. Just as a couple of final comments, more details on the Child Health Task Force. There, I think the link is going to be in the chat box for you to follow more information and to learn more about the work that's happening, how you can get involved. I think Diana includes that in there. Also, we'll have information on the Global Health Council Summit, which is November 19th and 20th, which will follow on to this great discussion and even more. As Nosa, I think, said, some of this stuff has happened before. We've talked about these principles, but the reality is we got to keep moving. We got to keep pushing it forward. And if now is the time to take advantage of that, that's great. We need to just keep pushing it forward. We really won't stop at having any more unnecessary deaths of maternal mortality and neonatal mortality. Is just unacceptable. So I thank you all to this amazing group of panelists, Diane, Nosa, Joe, and Celestine, for joining us, and again, for organizing this great discussion. And thank you to all the participants on the line for joining us today. Have a great rest of your day or evening, wherever you are.
And thank you very much, Crystal.
Thank you, Crystal, and thank you, everybody.
Thanks, Crystal.
Thank you all.
Thanks, everyone.